Welcome to the YouTube channel of Sibia Medical Centre. I am Dr. Sibia, Director Sibia Medical Centre. Today we will discuss about exercises for lower backache, stretch exercises for lower backache. Backache is a very common problem. 8 out of 10 persons sometime in their life are expected to experience backache. It is such a common problem that it is about the commonest reason for loss of work hours. It is so common that many people cannot go to work and have to stay at home, and some even have to leave their jobs or seek premature retirement. There are many causes of backache. It can be due to simple strain, muscle strain. It can be due to degeneration of the disc. It can be due to bulge of the disc, intervertebral disc prolapse, and many other reasons. So today we will discuss and show you how stretch exercises can benefit the back. With me, I have Miss Rupinder Kaur Sandhu to assist me and to give a demo of the exercises. Today, she is our model for the demonstrations. We are going to demonstrate 10 back stretch exercises. These are exercises that can be done by all healthy persons. Those having a back problem should consult their doctor before they go ahead with these exercises. We suggest that when you wake up, the first thing you do is do these exercises. Do the stretch exercises which will keep your back comfortable throughout the day. So now we start with the demonstration of the stretch exercises. We are going to demonstrate a set of 10 back stretch exercises. So now we start with the exercise number 1. You are ready, Rupinder?
Yes, sir.
The first exercise is double knee rotation stretch. In this, the shoulder is to remain on the table or on the bed, and only the knees are to be bent on one side first, then on the other side. Start.
Yes.
So here we have the knee rotation, both the knees, shoulder on the bed, and both the knees rotating to one side. We reach this position and we wait for 20 seconds. Since you may not always be able to see the watch, 3 deep breaths are roughly equal to 20 seconds. So first one side, then back, then the other side. 20 seconds, then back, relax. Now we come to the second stretch exercises. This is the single knee rotation stretch. In this position, first we bend one leg, put the hand on this and stretch it laterally how much we can, keeping the shoulder on the table or the bed as far as possible. In this position, we wait for 20 seconds or 3 to 4 deep breaths, and slowly we come back to the normal position. Stretch the leg, bend the other leg, and we stretch it on the other side as much as possible with support of the hand of the opposite side, and shoulder as far as possible on the table or the bed. Wait for 20 seconds and gradually back to the base level. This again can be repeated 5 to 10 times as per the comfort level. The next is knee to chest, single knee. Rupinder will now show you how this is done. bend the knee, hold with both the hands and pull it towards the chest as much as possible, keeping this as low as possible. Again, wait for 20 seconds, that is 3 to 4 breaths, and release the hands and bring the leg back to the initial position. The same is done with the other leg. Bend it, hold with both the hands, pull it towards the chest, wait for 20 seconds, 3 to 4 breaths, and again come back to the starting position. This stretch is again to be done for 5 to 10 times, and then we go ahead with the next stretch exercise. What we just saw was the single knee stretch. Now we will do the same with both the knees at the same time. Both the knees are bent. Hold with the hands and pull towards the chest. Wait for 10 seconds. Take 3 to 4 deep breaths. Relax and then come back to the starting position. Repeat for 5 to 10 times and then take a few deep breaths before we go ahead with the next stretch exercise for a comfortable lower back. Our next stretch exercise for the back is a Piriformis stretch. In this, the knee is bent, the ankle of the other leg is put on the knee, and she holds the thigh from behind and pulls it towards her chest. And stretch in this leg and also in this area. As we can see, the right knee is giving resistance to the left knee, is giving resistance to the right leg. And this is the whole secret of this exercise, that this leg is acting as a second person to give exercise to this leg. Back to the baseline, and the same is repeated for the other leg. The leg is bent, the knee is bent, the ankle placed on the knee, and stretch. She can feel the stretch both in this leg and in this thigh. Wait for 20 seconds, 3 to 4 deep breaths, and back to the base level, back to the basis posture. Again, repeat for 5 to 10 times. Initially, it may be difficult for many people to repeat 5 times even, but gradually as we go ahead, the flexibility of the joints will improve and become more and more easy to repeat the exercises first 5 to 10 times, maybe even more afterwards. The next stretch exercise is the hamstring stretch. Hamstrings are the muscles around this area, and for this we will require the support of either a rope, a tape, or something which is available in everyone's house, that is a chunni. The chunni is placed below the foot, and the leg is stretched with the chunni. It is a very simple exercise, and maybe she is getting the feeling of riding a horse. First one side, 20 seconds, relax, down, and repeat with the other leg. Good. This is pulled to cause a stretch in the leg. This is the hamstring muscle, which is going to feel the stretch effect in this exercise. We wait for 20 seconds, 3 to 4 deep breaths, and then bring down the leg. Repeat 5 to 10 times and get ready for the next stretch exercise. We come to the lower back stretch. You lie on the bed, arms on the bed, and first we stretch from the elbow. Come up, come up, come up. Good. The second step is to extend the arm fully. This posture, since it resembles the cobra, it is also known as the cobra pose. It gives stretch effect on the back, and she can feel the stretch in this area. You can feel it here?
Yes.
Good. 10 seconds initially, later on it can be 20 seconds, then back to the initial stage, back to the initial posture, relax for some time, repeat 5 to 10 times, and then we come to the next stretch exercise. Next we come to the child pose stretch. It's just like we see the children, how they behave. This name is given by observing the behavior of the child. The arm is straight and we take the posture of a child, stretch forward, right? And this is how we do this stretch exercise. Stretch as much as you can. Wait for 20 seconds, 3 to 4 breaths. Relax, back to the starting posture. Repeat 5 to 10 times as per your comfort level. Our next stretch exercise is the cat, also known as the cow stretch. In this, on all fours, just like the cat does, back up, chin on the chest, starting position. Then the head comes up and this goes down. In both cases, we should be able to feel the stretch on the back and on the neck. 20 seconds, 3 to 4 deep breaths, and back to the basal posture. Now we come to the last exercise, the 10th exercise, known as hip flexion stretch. First, on both the knees, kneeling down. One leg forward. Place both the hands on the knee and stretch your back, the hip and the upper leg. 20 seconds, 3 to 4 deep breaths, and back to the kneeling position. Repeat the same with the other leg. Leg forward, both hands on the knee or lower thigh. Stretch the back, hip, and the upper thigh. 20 seconds. Take 3 to 4 deep breaths and back. Repeat 5 to 10 times, and that is the end of this exercise session. Thank you, thank you. Thank you, Rupendra Sandhu, for your perfect, wonderful demonstration. Now a few more tips. As we grow older, especially the women, at the pre-menopausal and menopausal stage, there is deficiency of calcium. So they must take more calcium at that stage. Milk is a very good source of calcium, or they can have other non-veg can also give good calcium. We have seen that there is a acute deficiency of vitamin D in most of the persons who are having lower backache. Hence we suggest that under guidance of your doctor, take good amount of vitamin D. Good means good, not excess, because excess is also harmful. We suggest that the vitamin D level should be in the higher level of the normal range and not at the lower level of the normal range. Having it at the higher level of the normal range has a lot of benefits. We have seen many patients improve by improving their vitamin D level. So all this should be done daily. All the exercises, do them daily. Do them the first thing you get when you get up in the morning. So make sure your calcium level is good. Make sure your vitamin D level is more than 50% of the normal range. This will really help you in a big way. Have a good diet, have good sleep, have a good mattress which is not sagging in the middle. That is also very helpful. And with that, we come to the end of this session. I'm sure you will like it. You have liked this session. And if you have liked us, if you have liked our session, please don't forget to press the like button. Please don't forget to subscribe. And to know more about the future videos, please do press the bell icon. Thank you. Thank you very much. We meet again. Yes, one more thing. If you want to receive a e-booklet on these exercises, you can contact us on the WhatsApp number on the email address given below. Thank you. Thank you very much. We meet again next time for another interesting video. Thank you.